Hey guys, welcome to my YouTube channel. If you like my videos, please subscribe and hit the bell icon. You can also search me on Facebook, Twitter, and Instagram. I'll see you around. Hello everyone, you're watching Voice of South Asia. This is Health Talk with Nausheen Muehlbrad. बाल इंसान की शख्सियत और सेल्फ कॉन्फिडेंस का एक बहुत बड़ा हिस्सा होते हैं और अक्सर हमें हेयर फॉल या हेयर इश्यूज़ का या फिर स्कैल्प इश्यूज़ का सामना करना पड़ता है और यही वजह है कि आज हमने डॉक्टर सनोबर अमीन को अपने शो में इनवाइट किया है जिनसे आप पहले भी मिल चुके हैं. डॉक्टर सनोबर अमीन is a board certified dermatologist and we want to welcome her back to the show. Welcome back.
Thank you for having me again, Nausheen.
Yes, ma'am. So I want to give Dr. Sanober's introduction once more. She's the attending physician of Dermatology Solutions and she's also a published author. Well, doctor, I want to ask you about what is the difference between hair fall when it comes to men and women, and what are the causes? Are there different causes?
So hair loss can have many different causes.
Okay.
They can be age-related, senile hair loss or alopecia. We can have inflammatory conditions that can cause hair loss, which are the bald patches that can present with like no hair at all. You can have inflammatory causes that can cause over a period of time scarring of your hair fibers, and that can present in a certain distribution with certain symptoms. You can have mechanical causes of hair loss, which would be when people have a psychiatric condition where they pull on their hair themselves and cause bald patches.
Yes.
So there are many different causes of hair loss.
Okay.
One more I forgot to mention is hormonal, which can present slightly, even though the cause is the same, it can present slightly differently in men versus females.
Okay. So I want to ask you, there's sometimes like you usually lose hair, you know?
With time, we all do. Yeah.
We all do, right? And I guess we all go through certain cycles where we notice that, okay, ab hair fall thoda zyada ho raha hai, ab kam ho raha hai. So how do we know that it's unusual amount of hair we're losing?
So, we lose about 60 to 100 hair fibers a day.
Okay.
On the days we shampoo our hair, we can lose up to 150 hairs.
Okay.
So it's okay to lose more hair on certain days. The days you shampoo your hair, the days you style your hair, the days you perm your hair. Any styling that you do, any treatments you do on your hair, you will lose more hair on that day. So it's expected.
Because you're pulling your hair.
Yeah, exactly. The trauma is causing some hair loss. If it continues for prolonged periods of time, and you will notice that your shedding is increased, you'll see your bathtub clogging, and you will see that your hair is thinning.
Right.
That is a worrisome sign.
Okay.
Especially after a prolonged illness or an event like surgery where you were put to sleep. So general anesthesia can do that. Fevers, illnesses, viral illnesses, a big stressor in life, new medications that you started and old medications that you stopped, any hormonal medications you took, they can all trigger hair loss. And stressors in life in general can cause hair loss.
Okay.
There are also nutritional causes of hair loss, meaning if you were deficient in vitamins like iron, vitamin D, you can present with hair loss in that situation as well.
So I got this question from lots of viewers and बहुत सारे सवालात थे और यही थे कि बाल गिर रहे हैं कैसे रोका जाए.
So first and foremost, we need to find out what the cause of the hair loss is.
Okay.
You need to be seen by a dermatologist. They will do a thorough examination to see if the hair loss is coming or stemming from infectious causes, inflammatory causes, mechanical causes, or nutritional causes.
Right.
And then set realistic expectations. The head of hair that you had when you were 20 years old, you will not have when you're 80 years old. So be realistic. Whatever treatment we institute for your hair loss, it's going to, at minimum, prevent further hair loss, and at best it will grow back majority of your hair back, if not all of your hair back.
Right. Well, one thing I've noticed even in myself and in other people too, sometimes all of a sudden your hair just becomes dry and brittle. So what causes that?
So that would be the scalp health would come into question here. Is your scalp healthy enough to grow healthy hair?
Okay.
And the mechanical change, the textural changes to hair are usually mechanical causes.
Okay.
If you're over styling, over treating your hair, perming your hair, dyeing your hair,
they can
all
that's
cause
so
damage
common.
to your hair.
Yes.
They're not only damaging your hair texture, they're also causing hair loss. And sometimes the mechanical causes, when hair gets pulled, we call that traction alopecia. if you're pulling your hair back in a ponytail all the time, and your hair is under a lot of pressure being pulled back,
Tension, all the
under a lot of tension, that can cause traction alopecia. So that can play a role too.
That I didn't know that, and I do, wear ponytail a lot, so I'll have to be careful.
So with pulling your hair back, whether it's pulling back in a ponytail or weaving, braiding, it can pull your hair in a lot of it can apply a lot of tension on your hair.
Okay.
And you can have receding hairline.
Yes.
So
yes, I've noticed that too.
Yeah.
Okay, that's very interesting. So sometimes I have seen that one condition where you lose patches of hair, and it's all over like different places of your scalp. What is that?
So that is a condition called alopecia areata.
Okay.
It's an autoimmune condition in which your body's making antibodies. It's attacking the hair follicles itself. So it makes you lose your hair at the level of the follicle. It sheds the hair in those discrete patches. That's where the inflammation is most active. It usually presents with discrete bald patches, but it can it's not only on the scalp, it can be in your eyebrows, your eyelashes, any part of the body.
Okay.
And
how do you treat that?
So it's autoimmune condition, so you basically use anti-inflammatories that are targeting your inflammation.
Right.
So you basically use anti-inflammatories, whether they're topical, intralesional, or systemic medications.
Okay, so there's no antibiotics or anything. You just take anti-inflammatory for that.
So steroid topicals, either oral medications. So different anti-inflammatory agents can be used for this condition.
Okay, but you should go see a dermatologist if you're losing hair in patches.
Yes.
Don't wait, and the earlier you go, the better it is.
The sooner the intervention can take place, the better the outcome for everybody.
Absolutely. Awesome. Well, let's talk about dandruff. That's another issue that I'm sure you see a lot of patients
common,
for.
especially here in Texas.
Yes.
Yeah.
Okay, so why is it so common in Texas?
The fungus that causes dandruff, it feeds on oil. So a lot of patients will be oily on the central face and also on their scalp.
Yes.
So they're more prone to getting more dandruff because they're providing the food for the fungus.
Right.
So they will have it in any hair-bearing areas of the face because you have the oil glands associated with the hair follicles. So your eyebrows, the corners of your nose makes a lot of oil. It can go around your mouth, your ears, in and around your ears, and your scalp can be involved too. Some people will have it on their chest and their back too because they just make so much oil.
Right.
So you can have these dry, red, oily skin. And extremely common in Texas. I see every single day.
Is it like an environmental factor and genetics, or just
both?
Okay.
So your skin is making a lot of oils, and then the environmental factor is the fungus that overgrows in those oily areas.
Okay, so if you're living in certain states or certain places, you can have dandruff more than the other places. Okay, well that's good to know. So I want to know, how do you treat it?
Very easy treatment. We can use antifungals, anti-inflammatories, usually topicals. This condition is confined to the skin, the top layers of the skin. It does not need systemic medications. It's very easily treated by using two agents. One is aimed at attacking the fungus that's causing it, and the other one is aimed at treating the inflammation, the redness of the skin that you see in the central face and sometimes the scalp too.
Right. Well, that brings us to the time that we take a short break. We're in conversation with Dr. Sanober Amin. Stay tuned. Welcome back to Health Talk with Nausheen Muehlbrad. We're in conversation with Dr. Sanober Amin, who's a board certified dermatologist. और हम उनसे जानना चाहेंगे एक बहुत ही आम सा सवाल जो अक्सर लोगों के जो है वो दिमाग में होता है, वो ये है कि there's a large variety of anti-dandruff shampoos available in the stores. Do they really work?
Absolutely. most of these shampoos are designed to exfoliate the scale from your scalp, and then the prescription shampoos can help kill the fungus on the scalp that's causing the dandruff. So yes, it's important to use them both as prescribed by your doctor.
Oh, so you can use them both at the same time?
Usually I do. I prescribe both shampoos at the same time. I'll prescribe one, and then I'll have patients pick up the over-the-counter one that exfoliates the scale. So yeah, together they do work better.
Oh, that's interesting. I didn't know that. Well, I do want to ask you, जिन लोगों को डैंड्रफ का प्रॉब्लम होता है, अक्सर वो नहीं जाते डर्मेटोलॉजिस्ट के पास, ट्रीट नहीं कराते, वो ज़्यादातर एंटी डैंड्रफ शैम्पूज या ऑयल्स और बाकी टॉपिकल चीज़ें यूज़ करते हैं या खाने में कुछ लेते हैं, समथिंग लाइक दैट. What would you tell those people?
So I think it's reasonable to try over-the-counter options because most of dandruff of the scalp is of mild nature and it can be treated very easily by over-the-counter options.
Okay.
If your symptoms like itch scale is not coming under control with over-the-counter options, is when you would seek the help of a dermatologist to get you on prescription regimen for you.
Oh, okay. Well, I do. It actually brings me to another question: is people who use hair dyes. I have heard that it triggers your dandruff, or it can create sores on your skin. So
no, not at all.
It's not. Okay.
It's not going to cause dandruff. If you're getting sores from a hair dye, it's probably because you're allergic to a component in a hair dye called paraphenylene diamine, which is causing inflammation in your skin.
Is PPD? That right? Yeah. Okay. Yeah. So stay away from those hair dyes if you use hair dyes a lot.
And if you get a reaction from it, yeah.
Okay. So I guess जो patch test करते हैं, छोटा सा skin test करते हैं, that's probably better to do before you use any kind of dyes. Is there any alternative to it if somebody?
Yes. It's allergic to hair dye. Yes, I get this a lot. I probably see at least one patient a week with PPD allergy in my clinic. People will present, they've been to this many doctors before, and then they come with this rash that's worse along their hairline because that's where, after rinsing, the hair goes, the dye contacts them, their skin, I mean. And we have to give them PPD-free options. There are some hair dyes that you can get that are without PPD as well.
Okay, so how do you know? Like, is it something that you go to the store and it'll say PPD free, or is it
possibly? But we do have some names of products that we maintain for patients with allergies. We actually subscribe to databases that maintain lists of products that are without certain ingredients that are known to be allergenic. So we usually, depending on what kind of allergies our patients present with, we will give them a list of products that they can use that are safe for them to use given their known allergies.
Amazing. Well, I want to jump on to the next question, but before that, I want to take a short break. We're in conversation with Dr. Sanober Amin, who's a board-certified dermatologist. Break से आने के बाद हम बात करेंगे what is the difference between moles and warts, and क्या जो है वो हमारी health पर उनका क्या असर पड़ सकता है. So stay tuned. Welcome back to Health Talk. We're in conversation with Dr. Sanober Amin. She's a board-certified dermatologist. और हम break में जाने से पहले बात कर रहे थे moles and warts पे. So what is the difference? How do you tell the difference when you see different patients?
So moles and warts are completely different growths on the skin. Warts are caused by viruses. They are thickenings on top of the skin caused by the viral infection of the skin. And there are certain strains of viruses that are associated with skin cancer, especially cervical cancers. And we do have newer studies suggesting that a lot of skin cancers like squamous cell cancer and basal cell cancer can harbor the same HPV virus that causes the warts.
Oh, okay.
The moles are usually harmless growths that are caused by melanocytes, which are pigment-producing cells in the skin. Now, any of these can become cancerous.
Okay.
The cancer that you get
you answered my next question. Okay. Great, go ahead.
So, the cancer you get from moles is melanoma. So moles can be normal or they can be precancerous, meaning they can be slightly abnormal, moderately abnormal, or severely abnormal. These are all grades that are given by pathologists when they actually when we submit a mole for a biopsy specimen for pathology evaluation, they will slice the tissue very thin, mount it on a slide, stain it, and then look under the microscope to see the biological behavior of the cells that make up the mole. And that's where they'll assign the severity of the dysplasia of the mole, meaning how abnormal the cells are. Sometimes you find melanoma, which is a cancer that arises from cells that give rise to moles. Now, like I said, the warts can also have they can also harbor a virus that is oncogenic, meaning it has a potential of causing cancer. And we do find HPV virus sometimes in squamous cell cancers and basal cell cancers too. Slightly different presentation clinically and histologically.
So some people get like warts on their arms or their limbs, you know, and they tend to sometimes pick it. Is it bad to pick them?
It's not bad per se, because whatever treatment options we offer you is also sort of mechanical destruction of the wart. The freezing, the dissolving of the wart, we cut the wart sometimes. So we are also sort of picking at the wart. But what you are doing is by touching the wart continuously, you're attaching the virus to your fingers, and wherever you touch yourself next, you have the potential of spreading the virus there. You can be shaking somebody's hands and spreading the virus that way. You can be sharing utensils in the kitchen. You can be a kid and who's sharing toys with other kids and giving yourself warts that way. Warts are contagious.
So it's not a good habit to pick on your wart.
You cannot transmit a mole, but a wart that's harboring a virus which is contagious, you can theoretically pass on a wart to somebody else.
Well, that's good to know. So if somebody has a mole that could be potentially be cancerous, how would someone know, okay, you know, this mole is something that, so if it continues to grow, if it's pink, inflamed, and just getting bigger and larger, and skin cancers have a tendency to be pink, inflamed. They get bigger. You can have signs and symptoms like bleeding. It could be tender to touch. It could ulcerate. All of these are worrisome signs. So are they usually like bigger moles, or they could be like a dot size?
Could be any size. Cancers can be as small as 1 millimeter. They can be as big as a few centimeters, depending on how long you let it grow.
So is it safer to say if your mole is darker, that potentially can be okay?
Cancers, that used to be our belief. We used to teach ABCDs of melanoma. C for color. We used to tell our patients that melanoma is usually black or brown. Only now we know that it can also be pink in color. It could be colorless, which is what we call amelanotic melanoma. So yes, a dark mole, a mole that's different from the rest of your body, which we call the ugly duckling sign, is usually suspicious for a cancer, and there's no way to know unless you do a biopsy. But you can also have a melanoma in a pink spot. So any skin spot that's not healing, that's tender to touch, bleeding on its own, ulcerating, those are worrisome signs, and it needs to be evaluated by a dermatologist.
Well, that's really good to know. Well, I want to jump on to the next question, and it's going to be, what different types of skin cancers do you see besides what we talked about?
The melanoma. So melanoma is the third most common type of skin cancer we see. The most common type we see is basal cell and squamous cell cancer. And that's mostly for lighter skin, obviously. For Caucasian skin, we see more squamous cell cancer in patients with a history of transplant organs who are on immunosuppressive medications to weaken their immune system so as to not reject their recipient organs. So, and then in Asians and African Americans, we see cancers that have progressed a little bit longer because of the delay in diagnosis. Like you said,
because
we believe that we don't get skin cancers as much. The sun does not affect us as much as it affects white skin.
That was my next question, actually. Are there any environmental factors that... there are.
So same environmental factors is the sun. Medications, immunosuppression is another risk factor, family history. They can all cause you to have skin cancer. And melanoma, while it's mostly found on the skin of Caucasian skin, in Asians and African Americans, it's actually on the achial skin, meaning it could be on the hands, the feet, the nails. And usually it's very...
On the nails too?
Very aggressive, because it's found later in stages. So there's a delay in diagnosis, and by the time it presents, it is usually too late.
Well, what I take from it is no matter what skin color you are, you should be wearing sunscreen.
Anything that's not healing is concerning.
And just watch for the signs. always, and use your instincts, I guess.
Yes, absolutely.
Right. Awesome. Well, the next question I want to ask is what treatments are available?
For skin cancers?
Yes.
So obviously first is the diagnosis, and then the diagnosis will tell you how what kind of cancer it is, how aggressive it is, how deep it is. And based on that information, your dermatologist will make you suggestions, treatment options, which will be surgical as well as non-surgical.
Okay.
Non-surgical meaning we can use, for some superficial cancers, we can use immunomodulators that are designed to attack the cancer cells and sometimes precancer cells in the skin. So we can use them. There are some oral medications, systemic medications that we can give for patients who are not candidates for surgery. Say if the cancer is too big, too wide, too ulcerating, if it involves a huge surface area of their skin and they're not a surgical candidate. Obviously, if somebody, and I have seen patients who have presented with a huge cancer involving both their eyelids, part of their nose, part of their cheek, and they were not a surgical candidate. So we do have some systemic options for those patients too.
Is it like an inpatient surgery, or you have to go to like the
Depends on the surgery.
Okay.
Usually I do all of my skin cancer surgeries in my exam rooms here.
Okay.
I do refer patients out to most surgeons in the community for high-risk areas or bigger cancers. Or certain melanomas that require what we call a sentinel lymph node biopsy, they will go to a general surgeon too.
Okay.
But a majority of the smaller cancers, superficial cancers, and cancers below the neck, I can do them here in my office.
तो जनाब अब बारी आती है आपके भेजे हुए क्वेश्चंस को हम अपने शो में इंक्लूड करें और सबसे पहला क्वेश्चन हमें भेजा है अफशीन फ्रॉम स्वीडन शी सेज माय हेयर फॉल हैज़ बीन गोइंग ऑन फॉर years and they look dry and lifeless. I eat a healthy diet, exercise regularly, live relatively stress free. Please help.
So Afshin, first and foremost, we need to know what kind of hair loss you have. And we need to make sure that you're healthy enough to support a healthy hair growth. Your scalp is healthy enough that you do not have any medications that are causing this, that you do not have any underlying thyroid problems or any other metabolic disorders that could be explaining your hair loss, that you don't have any infection of your scalp, you don't have any inflammatory conditions of your scalp, that you're not pulling on your hair, and you don't have any autoimmune conditions that could explain the hair loss. So we need to do a thorough examination.
So you have to eliminate all this and find out what.
So hair loss involves exploration of many causes: infectious, inflammatory, metabolic, mechanical.
Right. Well, you did mention something about thyroids.
Yes.
So I have heard that people who have thyroids get hair loss. So explain, give us a little bit more information on that.
So hypothyroidism, meaning when your thyroid is not producing a lot of thyroid hormone. It can present with hair loss too. You can not only have hair loss on your scalp, you'll actually present with loss of lateral eyebrows as well, but you will have other manifestations.
Did you say that the side of the eyebrows?
Yes, the lateral third of your eyebrows will thin out as well.
Okay, so that's a sign. So अगर आपके eyebrows के आखिरी का हिस्सा जो है, if you're losing hair over there, that could be a sign that you
have thyroid disease.
Right, so you have to go see a doctor for that. Okay, well, that's good to know. Our next question is from Uruj from Panama. She says, my hair growth is quite slow. I barely go for a haircut ever. What could be the reason?
So Uruj, thank you so much for your question. I say that we need to evaluate your scalp, your hair, and your overall health to see why you're not growing hair at the expected rate, because normal healthy scalp will grow about 1 centimeter of hair every month.
Okay.
So it's important to know when you do go in for exam that your dermatologist part your hair in many different sections of your scalp to see the rate of your hair growth and how many of your hair are in the active growth phase. Okay. So I think you need an evaluation for sure.
So she should go to a local dermatologist and get it checked. There could be many reasons for it.
Many reasons, absolutely.
Awesome. Well, that brings us to the end of our show today. Thank you so much for being on the show once again.
Thank you, Nausheen, for having me on the show again. It was a pleasure.
Absolutely. It was our pleasure too. So if you would like to consult with Dr. Sanober Amin, her information's mentioned on our screen. जाते जाते सिर्फ आपसे यही कहेंगे कि अगर आप किसी मुश्किल से गुजर रहे हैं तो याद रखिए कि हर बुरा वक्त आने वाले अच्छे वक्त की नवीद देता है. यहाँ लेते हैं आपसे इजाज़त. Keep sending us your suggestions and comments to info@bosa.tv. अपना और अपने घर वालों का बहुत ख्याल रखिएगा, खुश रहिए और अपनी लाइफ को खूब enjoy कीजिए. हम आपसे मिलेंगे अगली बार अगले एपिसोड में एक नए टॉपिक के साथ. Till then, this is Nausheen Muehlbrad signing off from Health Talk. Ciao.